Hi, I'm Dr. Kahai from Southeast Pediatrics in Whiteville. Today I'd like to discuss a very common topic that gets a lot of parents worried about their children, and it's called asthma. What is asthma? Asthma is a reversible condition of the lungs where the lungs may get irritated for different reasons and start spasming, producing more mucus, which then in turn causes coughing and wheezing. This can be very tiresome and difficult for the baby or the child. Asthma is a disorder that can be life-threatening and should never be taken lightly. It is very important to seek treatment for your child if you think your child may have asthma. With asthma, the lungs are hyper-irritable. However, although it cannot be cured, it can be treated very easily. There are different medications we use to treat asthma. The most important treatment for asthma is to control the hyperreactivity of the lung, and we often do that with inhaled steroids. We can also do that with oral steroids, but we prefer not to use that because a child may develop side effects from the oral steroids. When a child is wheezing, we often will use what we call a bronchodilator, such as albuterol, to help the child breathe easier. It is very important that if your child is sick, you follow the directions your provider has told you to do for the medications, and let them know if you think your child is not responding to the medication to help them breathe better. It is also important to realize there are other conditions that can make asthma worse. Some of these conditions may be something as simple as allergies. Allergies start in the nose and go down into the lung. So if your child has allergies and is wheezing frequently, it is very important to let your provider know so they can direct therapy to prevent the allergies from irritating or worsening the asthma. Other things such as mold in the house, cockroaches, cigarette smoke can also be very powerful triggers for asthma. So removing those triggers would very often help to alleviate the severe symptoms of asthma and is a very essential part of treating it. It's very important to understand that although asthma is a disease of the lungs and you cannot see how severe the lungs may be damaged, that they can be further damaged by noxious stimuli such as cigarette smoke. If a parent smokes inside the house, it is crucial for them to go outside to smoke, change your shirt before they come back so the cigarette smoke is not on their body or they do not reek of cigarette smoke. Do not smoke in your car or your house if you have a child or a patient with asthma in the house. It is also very important to recognize some of the symptoms that may be signs of distress in your child. If your child is coughing severely to where they cannot catch their breath, if you have used the medical treatments that you have been instructed to do to control the asthma, and the child is unable to still catch their breath or cannot stop coughing, or if they're wheezing severely, please contact your provider or the closest emergency room. Asthma is a deadly disease and should not be ignored or taken lightly.